Hello, it's indeed my pleasure to talk here. I'm Yue Wu from Institute of Biophysics, Chinese Academy of Sciences. I'm a first-year PhD student. My presentation title is Findings of Vascular Changes in Small Vessel Disease at 7 Tesla. Small vessel disease is the most common aging brain problem causing cognitive impairments, strokes, dementia. CADASIL is the most common hereditary cerebral small vessel disease caused by mutation of NOTCH3 gene. It provides a good model to study SVD from a whole brain, both clinical and multimodal imaging perspective. Accumulating evidence has demonstrated clinical changes in CADASIL patients, including small artery damage, hemodynamic change, and cerebral hypoperfusion. These indicate that imaging and analyzing the small vessels have the potential to find indicators or biomarkers for SVDs like CADASIL. At ultra-high field imaging, higher SNR, enhanced inflow effect, and increased susceptibility effect will improve the sequence like TOF and SWI. Here, we aim to analyze vascular changes, including small arteries and cortical veins in patients with CADASIL using the mentioned technique at 7 Tesla. We enrolled 41 patients and 41 sex and age-matched healthy controls. We use Siemens 7 Tesla MRI system and 32-channel Nova coil. The protocol included T1MP reach, T2 flare, TOF, and SWI. Due to the benefit of 7 Tesla, the resolutions are relatively high. These images were used to evaluate MRI features like numbers of lacunar infarction, cerebral macrobleeds, white matter change, and SVD scores. In addition, every patient has taken mini-mental state examination and modified ranking skill test to evaluate cognitive function and degrees of dependence. Firstly, we want to use TOF to assess the perforating artery system and find whether this supporting system of brain changes and is it related to the clinical condition of CADASIL. Here is an example of maximum intensity projection MIP result of 3D TOF-MRA. Even the small vessels like lenticulostriate arteries (LSA) can be clearly depicted, and we use the 3D vessel structure to directly examine changes of the LSAs. We measure the number of stem and branches, length of LSAs, and the proportion of discontinuous LSAs. Besides the arterial structure's integrity, vessel function like blood supply can be assessed using oxygen saturation. This will affect the rate of deoxygenated hemoglobin in the blood, and that will determine the vessel's overall susceptibility, especially in the veins. So we want to use venous susceptibility to find the blood oxygen saturation change. We use SWI magnitude and phase image to reconstruct quantitative susceptibility data. This step uses the susceptibility mapping and phase artifact removal toolbox. Thank Professor E. McHagg for this software and the menu. Then we used MATLAB to perform ROI-based susceptibility analysis. For veins, whole brain was mapped to 9 images with maximum intensity projection. Appropriate thresholds were set to filter out the non-venous signal in each image. Subsequently, bilateral ROIs of cortical veins were selected manually to measure average susceptibilities. Here are some results. For LSAs, we observed a decrease in the number of LSA branches and an increase in the proportion of discontinuous LSAs in patients with CADASIL when compared with healthy controls. Below are here are two typical images, and the red arrows shows the decrease of number of branches in CADASIL patients and increase of proportion of discontinuous RSAs. There was a positive association between the number of RSA branches and the mini-mental state examination scores of CADASIL patients after adjusting for age and educational level. This revealed that the vessel lumen of RSAs changed in CADASIL patients, and the abnormalities of small arteries may be related to some of the clinical symptoms of CADASIL patients, such as cognitive impairment. However, since we observed no association between the RSA measurement and the basal ganglia lesion load, we can't use the RSA's measurement directly as a strong indicator for CADASIL. On the other side, for cortical veins, we found that venous susceptibility increased with age and was higher in the CADASIL patients compared with the healthy controls, suggesting decreased venous oxygen saturation in CADASIL patients. Furthermore, we found positive association between venous susceptibility and MRI lesion load, including the age-related white matter change scores, the number of lacunar infection, and the number of CMBs in patients. Moreover, increased venous susceptibility was independently associated with higher modified ranking scale scores in CADASIL patients after adjustment for age and small vessel disease scores. These findings reveal the potential of venous susceptibility to be used for the clinical evaluation of CADASIL. There are two typical patients at different degrees of dependence. It can be seen that increased venous susceptibility and severe brain lesion features in patients with higher MRI score. This indicates that comprehensive patient assessment using multimodal and multi-parameters still need to be dug deeper. In conclusion, high-resolution TOF-MRA at 7 Tesla revealed small artery damage, especially in the basal ganglia area in CADASIL. Susceptibility-weighted imaging and mapping revealed cerebral hypoperfusion caused by small artery pathology. In addition, venous susceptibility was associated with MRI lesion load and functional dependence of CADASIL patients, indicating the potential to be an imaging indicator for evaluating central nervous system damage in CADASIL. Together, these findings prove that 7 Tesla MRI is a promising method to assess the vascular changes of patients with SVD. Thank you.